Honorable Roosevelt Skerritt, Prime Minister of the Commonwealth of Dominica, Honorable Dr. Kenneth Darrow, Minister for Health and the Environment, other honorable members of Cabinet, Honorable Lennox Linton, Leader of the Opposition, Your Excellency Steve Farrell, Secretary of the Cabinet, Mrs. Rosamond Edwards, Financial Secretary, Mr. David Letang, Permanent Secretary, Ministry of Health and Environment, other permanent secretaries in attendance, Mrs. Janice Jean-Jacques Thomas, Director, Dominica Social Security, Mr. Stanley Lalta, Health Economics Unit, University of West Indies, Monsignor Eustace Thomas, members of the staff of the Ministry of Health and Dominica Social Security, other invited guests, members of the media, ladies and gentlemen. Firstly, this is a very easy speech for me to give because this is an issue that's very close to PAHO's heart in a way, and that is because it involves universal health and universal access. And I won't go into very detailed descriptions of what they mean. It's a fairly simple concept. And what that means is that the population will receive good quality health care without barriers to access because of cultural differences, gender differences, etc., and also without undue financial hardship. I'd like to stress the third one because that is very important, without undue financial hardship. If I may review for a second, Dominica is known for its primary health care structure. I know it quite well. Not only do I work for a Dominican at the head of PAHO, who is critically involved with the primary health care movement here, but this is where you punch, another area where you punch far above your weight is in primary health care. Far, far above your weight. It's not the only one, by the way. Your cooking's not too bad. However, you're upgrading your hospital. I've seen the numbers. I've been on 2 or 3 different occasions to Princess Margaret, and I see that the new National Hospital is moving forward. I've seen the floor plans. I know them quite well, and it is truly impressive what the hospital is going to deliver. The other side of this is I've also seen the numbers. I've seen the numbers of the user fee structure. I've seen the revenue that comes in at Princess Margaret, and I've seen the groups of individuals that are rightfully exempt. Unfortunately, money's part of healthcare. And I also know that Princess Margaret does its best with its limited resources, but I also know that there are groups that are going to find it difficult to pay. I've had very detailed discussions with the very, very efficient staff at the administration at Princess Margaret Hospital. It is indeed a pleasure to work with them and hope to work with them again more into the future. So, we know that you've done a pretty good job with your primary health care. You've got a new hospital coming on board. I also know, and I've read recently, that the Margot Hospital is not going to be a dream. It's going to be much more of a reality. I also read about the gracious donation from the Mexican government, $5 million. That is something to be applauded from numerous directions. But if I may, let's return back to poverty, and let's return back to making sure that those that cannot pay don't have financial barriers to care. We know that Princess Margaret charges for delivery care services, and we know that they would not like to, but we know that they have to due to financial constraints. With that in mind, that makes, and also evidence is beginning to show that in other countries, and I'm unsure of the documentation here, that poverty can exist in young households. The mothers with numerous children, maybe even one child, sometimes can be single parent households. These are vulnerable groups. These are groups that are either in poverty or can quickly fall into poverty. And remember for a second, who are these people? I have a mother. This bold initiative is protecting the house from which we came, period. It's protecting mothers and children who are prone to poverty. And that is bold, because what it's saying is, it's saying we're trying to protect those that are vulnerable. And funny enough, when a child and a mother have a good, healthy few years, they're going to be healthy kids. This is the future. In a way, we're protecting against poverty, or falling deeper into poverty, or falling into poverty, and we're protecting our future because we're protecting mothers and children. So again, I applaud such an absolutely bold maneuver. Again, why is this also of significance? It's of significance because in a way we're taking money from the greater Dominica community. And what do I mean by that? There are Dominican people born here, there are people who love coming here, such as myself, there's people who work here, but there's a wider Dominican community, and that wider Dominican community also includes citizenship by investment. So what you're doing is that you're sharing the risk across the wider Dominican community, because in a sense, you're sharing it from the wider Dominican community to assist those that are most vulnerable. And you're helping Princess Margaret still have stable revenue, which it needs. So again, those three factors are something that those of us in the business of health finance realize that it is so significant and so creative, the solution. If I may return to Social Security, Social Security has a well-trusted name here. It's a trusted institution. I've had the privilege of attending some very spirited discussions about Social Security benefits around sick leave and what people are entitled to. And I was so impressed by the dignity of the responses. People may not understand completely what the benefits are, however, they were clearly explained on the two occasions that I've seen Social Security in action. Why is this important that this money is distributed through Social Security? It's important because Social Security is trusted and Social Security is used to making payments by claim. They're used to doing it. They're doing it for disability. They do it sometimes for medical care needs associated with sick leave. They're a trusted institution and they're good at it. So that's another bold part of this initiative. I'd also like to highlight the role of the private sector. The private sector are also included, to my knowledge, as part of this benefits package. Again, that is working to the strengths of the private sector. The private sector is part of the healthcare community here, as in every country, and it's again something that I applaud. Just on the last part of something that I'd like to discuss and it was mentioned by the Director of Social Security. Again, this is clever, but you're starting with health insurance with a population that needs it. We have high suspicions that they are prone to poverty, but also you're starting in a limited way. You're seeing how it's going to work. You're seeing how it works when it goes through Social Security. Every country has its own path to universal health. Your path seems to be through this national health insurance scheme that's being launched today. Clever and also practical, because this is a big building block towards national health insurance into the future. And again, I applaud the initiative made by the Prime Minister and Cabinet, and it's something in which I eagerly await to work on, PAHO awaits to work on with the Health Economics Unit, Ministries of Finance, Health, and the Dominica Social Security. Thank you.